Welcome back to the show, Talk with Your Doc. In the month of November, we are talking about prostate cancer and the role of radiation in prostate cancer. And Dr. Hagerty is helping us to understand the radiation therapy and its side effects. Thank you, Dr. Hagerty, for coming again. Now, we were talking before the break about the side effects of the radiation therapy. Now, if somebody gets the radiation therapy, how long these side effects last? 1 week, 1 month, 2 months? How long does that last?
Radiation oncologists usually divide up side effects into acute side effects, which would be things that will come and go within 3 months, and long-term side effects, which would be more of a problem 3 months or later after treatment. So often when we're treating prostate cancer patients, the acute side effects are largely resolved within a month after radiation. And so that's bowel and bladder irritation, having to pee more often, more bowel movements in a day, that sort of thing. For the more later side effects, that can last for as long as a patient lives. So sometimes it can mean that the bladder might not want to expand as fully, and so somebody might have to go to the washroom a little more often than normal. It could mean that there's scarring in the urethra and the urine stream is not as strong. Sometimes that even requires opening that up again. Not common, but it does happen. Mm-hmm. Sometimes if the rectum received a high dose of radiation because it's right against the prostate, or if the patient just has genes that make them more sensitive to radiation, the rectum can be affected, and sometimes, especially if they were constipated, they could cause some bleeding from the rectum. And that rectal bleeding can continue for a long time, and if we do have treatments for that, and hopefully I can get that under control within a few months, and if that's not possible, then we can even look to do a laser treatment to stop the bleeding.
Not all the patients gets all these side effects. Very few patients will get all these long-term side effects probably.
That's right. We don't normally see problems, but if you see enough patients, then they crop up for sure, yeah.
Now, after the radiation is done, how long it takes for the patient to go back to their normal routine life, like to go to work or exercise or?
Yeah, I actually tell men that are living in town and they're active at work, I tell them, if you want to have the radiotherapy, the external beam radiotherapy, you could even try going to work every day and keeping life just as you were doing before you started, and just come to the cancer center for that time every day and get back to work afterwards. And usually that's possible to do.
Wow, that's good. Now, is there any specific type of diet one has to follow during the radiation treatment?
Yeah, it's best to regulate the bowel movements so nothing is really building up in the rectum, because that can, if there's too much stool in the rectum when you're getting treatment, it can actually push the prostate out of where it had been when we were doing our calculations. So we do a scan of that area of the body, and we do our calculations on that scan, and then we have the patient go into the radiation room and we do a mini scan as well, and then we kind of line up the body where it should be related to where they were expected to be based on that initial scan. And so we hope that the rectum would be empty each time for treatments, and so we can get patients to have a low fiber diet. And also sometimes we get them actually to take a medication to speed up the bowels just a little bit so nothing's really building up. Also for the bladder, we want to get that nice and full, so we get them to drink water before their daily treatments.
Okay. Now, if somebody gets this radiation therapy for the prostate cancer, what is the probability that cancer will come back after the treatment?
It depends on the stage of the cancer. So if it's low risk prostate cancer, the chance of long-term control or cure would be very high. So I'd be talking well over 90%, hopefully even 95%.
That's good.
Now, if you're looking at more aggressive cancer, so very high risk cancer, very aggressive, very disorganized cells that you would see under the microscope, then it would be much more difficult to cure that. And so the chance of control might be only say 40%, between 40 and 60% at the 10-year mark. So really, there's a real big variance based on what you see at the very beginning.
Now, how does one know that radiation is working? Is there any tests one has to do, or biopsy, or how do we know?
Well, after the treatment is done, we have a very precise test called the PSA test. That stands for prostate-specific antigen. That's a protein that's normally made in the prostate gland, and after we've treated with radiation, the gland is no longer functional, so it's not making PSA anymore. So if the PSA starts to rise after radiation, that often can mean that the prostate cancer cells are still active, and if they're dividing and becoming more numerous, they will also make the PSA too, just like the regular prostate gland cells. And so the PSA will start to rise, and that will be a cue that the cancer is active. I can also do a rectal exam to feel for a concerning nodule that might be developing, but actually the PSA test is so sensitive that that will often come up before you could even detect it in any scan or physical exam.
Now, so you said PSA test, how often one has to do the PSA test after the radiation?
It depends again on the profile of the patient. If I'm really worried that there's a decent chance that the cancer will come back, then I'll do the test more often. So it might even be every 4 months or 6 months. And if they've had a fantastic response to treatment and they have less aggressive cancer, after I've seen them and the PSA has come down, we might start to span it out much further apart, like every year.
So a patient has to follow up every 4 months or 6 months? How often?
Yeah, it depends on the profile. So I'll tailor the follow-up based on how worried I might be.
Wonderful. You gave us a lot of information about the role of radiation in the prostate cancer. Thank you so much for your time.
You're very welcome.
Thank you, everyone.